Hi, good morning. Good
Good
morning. Welcome
morning.
to the Empowering New Nurses Show. It's just a great pleasure to have you here. You have joined many who have come on before, and they have been excited, and they have blessed the audience of our young nurses who have been coming on board. Now, this morning, I'm Dr. Miriam Smith. I'm the host for Empowering New Nurses Show. From my years of experience, I'm just excited to impart some of the knowledge that I've gleaned over I would say 4 decades. And it's just a pleasure to have you on. Just tell us your name and tell us a little about yourself.
Thank you so much. It's a pleasure to be here. My name is Gentille Sandy. I have been a nurse for 5 years, worked in pediatrics. I'm currently in Maine right now, came back from Texas, but it's good just to be on here. Empowering nurses is very important, and I just love the work that you're doing. So thank you so much.
You are welcome. You are welcome. So, as a young nurse, you're beautiful. You're a young nurse,
Thank you.
have traveled different places. Tell the audience right now a little about your experience as a nurse and
Yeah,
a new
absolutely.
nurse in particular. When I say new nurse, anything from, for me, anything up to, say, 5 years. Could be, depends on the area you're working in, the specialty, to gain that grab and hold of things and be more confident and all of that. Not that you know everything, but you're able to deliver care with rational, critical thinking and all of that. So tell us a little about your experience as a nurse.
Yeah, absolutely. So I was very fortunate. I got into a nurse residency program.
Wow.
I don't know if a lot of people know about those. Really, what the residency program does is that it takes new nurses and it puts you in kind of like another year of, I don't want to say school because you're not really graded, but they kind of like help guide you through in that first year, that transition from being in school and going to clinicals to then like being the nurse in the hospital, which we both know is very different. um, so it was really good. I started that program in 2017. I went into their surgical track. So they have three different tracks for that one. They have a med surge track, they have a critical care, and then they have a surgical track. And so I did the surgical track. It was me and just another nurse in my small group, but we'd come together for meetings. I think it was like maybe every couple weeks as a big group and do like debriefing. And that was just really great because you're hearing from other areas and what they're going through. And we cried together, we laughed together. It really was a bonding experience. We also had classes where they would teach us, just more stuff additional to what you learn in nursing school or refreshing you on things. And then you had nurses on the floor who you worked with as you became more independent. So I would definitely recommend that to other nurses who are graduating because it really just helped gain my confidence really big. And then we also had to do like a big evidence-based project. So that also got us into being able to present, doing research, what that looked like, working as a group. Um, Definitely an amazing experience. So that was a year long. You then get placed into a unit. I mean, you're guaranteed a job, you're paid throughout the whole thing, but then you get placed in a unit. And I got placed in a unit that I had not rotated through because at the time those units never really had openings. But then when I was being placed, I got placed there. So that was a flip upside down. I was like, oh no, how is this going to be? Because with the year, you feel like, okay, I've met people, but then getting placed in a place where I didn't really know them. But because that hospital was so great, I really had an easy transition. And because I went through that year, going to that new unit wasn't as difficult as I thought that it was going to be. I worked with some incredible people. So I worked in what's called this special, goodness, my brain is drawing a blank. It's called a spa. So the like special procedure area, sorry, that's what it's called, special procedure area. So they did procedures for GI, they did procedures for neuro, and they did procedures for oncology. So we did a lot of lumbar punctures on patients and like bone marrow, BMA. They also did transplants there too. But and then the GI procedures, so like the endoscopies. We also worked with radiology, so the kids that had MRI scans. So I did that for 3 years. And then I moved over in the same unit under same management, but became a GI nurse. So I worked more with the GI doctors for a year until I moved to traveling with GI with adults. So
Okay.
um, I guess that's been my path. Very different, I think, than a lot of nurses.
A lot of young
I
nurses.
definitely, yeah, a lot of young nurses. I definitely am that nurse that, took that different path. A lot of people say you have to go into med surg first, and I'm kind of the the different path person
Yeah.
who says like if it's your dream and love it and you have the opportunity, then why not go into what you love? Not to say that med surg isn't wonderful, and I understand why people say going there first, but for me, God just opened the door to go into surgical care. When I was in nursing school, every rotation that I went into, I ended up in the OR or my patient needed surgery or something. So I had that exposure.
Okay.
And I felt like God then opened the door for that because a lot of nurses don't have that in nursing school. Um, I just had a unique situation. But yeah, that's kind of my track through.
Well, thanks for sharing that because very often you would have your nurses, our regular nurses, our new nurses, they would actually start. That was the norm at one time. It's not so
Yeah,
anymore, right? So, from your experience in the GI, there's just a sentence or two you might just tell me what was sort of profound that you mentioned God just now, but what
yeah,
when you say we know we are creative, we are wonderfully made, right? But
yeah,
there is a part of I've had some endoscopy, I've had some colonoscopy experiences in nursing, GI experiences. So, but there's something special about when the colonoscopy is being done, when the probe is being going. There's a section that you're looking for to reach. Can you just give a little brief, anything about that little part that just grab you and you say, when you've reached there, you say, wow, when the doctors reach there.
Oh, when they get to they call it the cecum or the TI, the terminal ileum. Endoscopy is really interesting. I don't know, a lot of people hear endoscopy and I think they're like, I don't know, they just think you're dealing with poop or different,
Right, right,
they don't
right.
really
And
know that the patients are cleaned out and things are super clean, which is like the ideal situation. But the body really is amazing. Um, but yeah, when the doctor is doing a colonoscopy gets to they call it the cecum, which is that top connecting to the large intestine to the small intestine. Um, it's really interesting. The tissue is really different. It's like you
it's
get to learn
you
the
see
landmarks.
that beautiful yellowish color, and it's just soft, velvety.
Yeah.
When you say, "Wow," you're always looking to reach right there.
Yes.
Oh,
Yeah. And there's
it's like you're out in the sea, and then you come to a beautiful some corals that are just so
Yes, it
yeah.
really is like
That's
corals in the terminal ileum. That's how
yeah,
you know.
yeah.
And yeah, that fact that they can maneuver the scope in that way, it's a lot harder than we think that they make it look really easy. But yeah, I've learned so much
Yeah.
working. The GI doctors that I've worked with have been very great at teaching. And then you just yeah, it's really interesting to see patients and what they're going through, things that we find so normal
Mhm.
for us, they're having a difficult time. And so to be able to be a part of helping them figure out what's going on or, just working through that path of health, which is what they desire, was really great. It was, you do have the sad parts of people getting diagnosed with Crohn's or, different
Some
things that,
polyps coming
changes
up
their life.
there, and there's
Yeah, polyps.
different sort
Yeah.
of tissues being shown. That can be
Yes.
difficult. And you're the nurse inside there, and sometimes when you see the nonverbal languages, it can
Yeah.
be difficult at times. Yeah, thanks for sharing
Yeah.
that. Now, as you travel, now you have done a little of the travel nursing. What
Yes.
has that been like to you? Do you normally get the type of patients that you're anticipating, or do you have experience where you're bullied, or any experience that is not the norm, the preceptor that you might have had, or tell us a little about that as a nurse and a new nurse.
Yeah.
Yeah,
I know.
tell us.
Um, yes, traveling, I feel like I really didn't know that much going into it. I mean, you hear about traveling and I think you have this perception, you're making a lot of money and you're going to these different places. Um, and it's hard to like know and expect anything when you're going into it. So I felt like traveling for me was definitely a learning experience.
Mhm.
I was very blessed to the hospital I worked at did not treat me badly. I didn't experience bullying. They were very receptive to me, and I know that that's not always the norm. I've talked to individuals who, they get given certain patients because they're a traveling nurse, or the nurses that they're working with don't treat them as well because they know they're making more money.
Mhm.
But for me, I feel like I got kind of the ideal situation of people who were just happy to have help and happy that they didn't have to take on as much of a load as they did before I got there. So that was a good experience. But traveling itself, I would definitely say to talk to people who are traveling and then figure out I guess figure out all the details. Because for me, you know this, but I hurt my back while I was traveling. So then that took me on a completely different path of being the caretaker to then being the patient, and that
Ah,
flips your world upside down. Um, but I learned a lot in that process of, knowing where where your insurance and when you're taking insurance from a traveling agency and like anticipating what maybe is to come and so that you're set up for it. But my experience was definitely, at least at the hospital, was a really great one. I had people that helped me get to the place of like taking the patients and I was able to speak up and if I didn't feel
great.
comfortable with
I
certain
like what
things.
you said
So
there, right there. Speak up. Now,
yeah.
was there an experience you had where you were like, because you're new, somebody might have thought that, you didn't know this or you should have dealt with something differently, but you had to speak up? Have you had that experience at any time as a young nurse where you had to
Um
say, you know,
yeah, like having to speak up on something.
yeah,
Yes.
tell
They
us about it.
yeah, so I feel like I didn't have that traveling. Um I definitely, man, I'm trying to think of one experience in when I was in Texas about speaking up.
Did you
Um
say anything for the patient and you had to say something to the doctor about something or something you see maybe should have been addressed earlier and you had to say something or it just went pretty normal in any case?
Working in surgery or anything related to surgery, I feel like you have to gain that confidence of
Be
speaking up
assertive.
because,
Be assertive.
yeah, you are also part of that care. And we all have to keep each other accountable. And there's
A
times that things can
team,
get
team. That's a
missed.
component of being a team player,
Yes.
right? Okay.
Yeah. And a lot of people, I don't know, it's easy when you're the new nurse to feel like, oh, I don't really want to say anything to this doctor. But
Mm-hmm.
I felt like in the residency was and the nurses that I worked with who were, helping me along the way instilled that.
Yeah.
And I think also my personality and my mind, like you have to think of it like if it was your family
And
member,
it
you
was
would want
you.
someone to speak, or you would
Yeah.
want someone to speak up and say, hey, this isn't right, or like, hey, you broke sterile field, and
All right.
you can do this in a better way. There's ways to go about it. Like, hey, doc, would you like another pair of gloves,
All
or
right.
certain
Love
things
that.
like that.
Love
But I have had experiences where, advocating for my patients, a very big thing. And working with kids, which is what I did in Texas, your kids are like my passion. I love working with kids. You also have their families and you're, kind of you're there for both. So there's definitely been times where, I had a patient who let's say, I don't know, like a simple thing where kids would get IVs before they go back. And as the nurse, I'm with that patient in that initial stage and seeing how they are and seeing how they react. And I was able to gain that confidence to have conversations with anesthesiologists to say, hey, this is kind of the plan I think would be better for this patient. So that we're all getting to the goal. We're all here for this patient, but saying like, I know you went in and this is the plan that you had, but I really feel like after being with this patient, talking with their parents, seeing how they're interacting, this would be a better plan, so that then they don't have a negative experience
Right.
with us. Coming to the hospital is already hard as a
Yeah.
kid. So we tried to help that experience. And yeah, it was times where it could be easier to just go with the doctor's plan. Um, I definitely was able to stand up and say, this is what
Thank
I
you.
think should
Thank you. As a
happen.
young nurse, yes. I have been an educator for many years, and I know that can be challenging for my young nurses. But
Yeah.
there's an acronym that I usually use from the team step, and that I would say is CUS, that CUS. You're concerned. If you see that's going on, you're uncomfortable, and it's a safety issue. And when you say that, and the doctor knows it, you know it, and whoever the interprofessional team, they know it,
Yes.
you know. And so it's important as a young nurse, and I must say congratulations for that, because it's
Oh,
not
thank
as
you.
easy as it might seem, you know.
No,
So as
it's
we
not.
come into the end of your interview this time, I
Okay.
I anticipate you coming back again. But at this time, what would you tell a young nurse, or a nurse coming on board? Give us a few pointers that from your experience you would want to just share. Just tell them. We have a few minutes more to get that under our
Yeah,
belts, all right?
absolutely. I would say nursing is a calling, and I think that's something to remember as you're going through, that you were called into this, and um you're able to be a light, wherever you are. And I guess as as well, that you're so important. I mean, I know in 2020 that we were seen as like the heroes, but we really are such an important part of the process wherever you are in nursing. You're able to be with that patient so much more than other people. And you're the advocate for that patient, and that step, that, that person that may be the only person that is able to advocate for them truly for what they need and what they want, and being able to help them through that process. So new nurses coming in, things have changed from COVID, but it is very important what we do. And I just think it's a remarkable thing to remember that, how important you are, and you can stand up for yourself. And it's a learning after even learning out of nursing school. So I think definitely a big advice that I took into when I went into nursing was just be that learner wherever you go. Even if it's not your favorite unit, if it's not, where you thought you would be, there's always something that you can learn from somebody that you're with, or the unit that you're on. That experience, like, is gonna help you later on in life more than you think it will. So go into it with an open mind, um, and just take it all in, because the years go by and you look back and you're like, man, if I think about what I started and was so scared about doing, and now it's just like second nature, and
Right.
you've gained all this knowledge. Um, so yeah, definitely for the new nurses to be encouraged, but going with an open mind. You're so valuable. And just continue learning, continue giving that care like if it was your family member. Really, the patients just, they deserve it, right? And you would want that for you. And also be a great team player. When you are, things are just so much easier. I feel like everyone is willing to help you if you're willing to be that team player, and connecting with everyone, even down to the housekeeper and those who are helping in different roles. They're not beneath you. We're all here for the same purpose, which is to care for these people and keep things running. Because I've definitely seen that having those relationships with those people help you. They might be the ones that help you later on, um, with things that you can't even imagine for just what you need in your day to day. So I guess those are a couple tips that I would
Listen,
say.
you have said so much.
Oh,
Said so much
thanks.
that I know that these nurses who are coming on board, they will be inspired by what you have just said. Thank you so much
Oh,
for having
good.
come on and shared with you. But I want, in
Absolutely.
addition to all of that that you have said, remember
Yes.
self-care. Remember
Oh,
self-care.
yes. That's
Regardless of
something I've
what's
had to
happening,
work on.
remember
Please.
self-care as you go.
Yes.
So,
Yes,
Jan,
absolutely.
It was a
Yes,
pleasure having you on the Empowering New Nurses show today. And I look
thank you.
forward to seeing you again, because the words and the tips that you have given and the experience that you have had and that you have shared, I know this will greatly impact positively the young nurses who are coming on. Now, on this platform, there is a book that will be coming out by March 21st, The Guide to Empowering New Nurses by Dr. Miriam Smith. And I look forward to you and others having a copy of it. Because if you should look on this website, on this site here, on the podcast, and also listening on the podcast, and also on the YouTube, it's Empowering New Nurses by Dr. Miriam Smith, DNP. Now, I've had over 4 decades of nursing experiences, both academia and clinical practices. And so I know I have a lot to offer, to share, to enhance. You just have to take your points out, what's relevant to you, and learn. So it was a pleasure having you. And how I can be contacted? I can be contacted on YouTube at Miriam Amanda Smith, on podcast at Podcast Mir. And of course, I'm on Apple and I'm on Spotify. So thank you so much for coming in, and those who are listening. And the charge is the best high quality care that can be given. That is what we are encouraging. That's what we are embracing at this time. So thanks again for coming, and have a great 2023. And keep up the good work. I'm proud of you. We are proud of you. All right. Have a great day. Bye-bye.
You too. Bye.